Hi, I am Lexus Perry. I'm a senior majoring in exercise science with a concentration in pre-athletic training. And today we'll be doing the pelvis and thigh evaluation video. Okay, first I will palpate the location of the dorsal pedis artery, which will be right here. And then I will also palpate the area for the posterior tibial artery, which is back here. And now to do the capillary refill test. So squeeze your toe and release. It did refill. One time. Okay, and that proves she has proper blood circulation to her feet. Okay, and now I'll ask for you to do the active range of motion for hip flexion. So bring your knee to your chest, please. Don't grab it. All right, put it back down. And do it one more time, please.
Different leg.
Same leg. Okay. And now I will ask for you to do hip extension. So if you can lie prone, please. That's on your stomach. And lift your leg up as high as you can, just using your hip. Do not bend your knee. Okay. And one more time. Okay. And next will be the active range of motion test for hip adduction. So can you perform that for me, please? Just move your leg out as far as you can. Okay. And adduction, can you raise that leg at 90 degrees, your right leg at 90 degrees? Okay. And then move your left leg inward. Rotate it inward. Okay. Now the active range of motion for internal rotation. So can you rotate your foot inward? Okay, and then outward. Okay. Okay, so next we will do the manual muscle test. Manual muscle test for hip extension, flexion. So if we lay back again. And basically just try and flex your hip, and I'm going to be a resistance. Okay, so. Bring you to your chest. Okay, so go. Okay, and then you can keep it raised. So now we're going to do the manual test for the extension. So can you flip on your stomach? Okay, and try to extend your hip, please. Okay. All right, and now you can flip back over. Next, we'll be doing the manual muscle test for hip adduction. So we'll resist you as you try to extend your hip. Okay, and now we will do adduction, so raise this knee at 90 degrees. You can bend it at 90 degrees. Yeah. Alright, hold it right there. And try to move your hip inside for adduction. Okay. And then, if you can sit up, please. The manual muscle test for internal and external rotation. So try to rotate your hip internally, please. All right. And now externally. Okay. And we also have to do the manual muscle test for knee extension. So try to extend your knee, please. Okay. We also have to do the passive range of motion for hip extension, abduction, adduction. Okay? So you can lay back again for abduction and adduction. Lay all the way, scoot back some more. Alright, so we'll do abduction first. You don't have to do anything, I'm just gonna move it. Alright, so it's for abduction. Then raise this knee up again. Okay, and then also for hip passive range of motion for hip extension. So can you lie prone again on your stomach? And this extension. And now we will do the Trendelenburg test for gluteus medius weakness. So if you could please turn around and flex your knee backwards. Okay, and her hips are even, so that's not a positive sign. A positive sign would be the pelvis lowers on the non-weight bearing side, which it did not. Okay, and next we will do the Thomas test for hip flexor tightness. All right, so take your leg, you can bend your knee. Yeah, it's pretty much just a stretch. All right, and her hips stay on the table, so there's no tightness. And the next one would be Eli's test. So if you lay prone again. Okay, and I'm going to do it on this leg. And I'm just going to bring your knee up and then back. Right, and one more time. Up and back. All right, and a positive sign for the Eli's test would be the hip on the side being tested flexes, causing it to rise from the table, and as you can see, it did not. So she passed that test. The positive for the Thomas test for the hip flexor tightness would have been the involved leg rises off the table, which it didn't, and the knee didn't move from extension. All right, next would be the Ober's test for iliotibial band tightness. So can you just lay on your side and your stomach facing to you? All right, and all I'm gonna do is just take this leg and bend this knee. All right, and I'm just gonna bring it back. Okay, and one more time. I'm gonna lift it a little bit this time. Just and a positive sign for an Ober's test would be the femur adducts past the horizontal. Minimal tightness would be indicated by the femur adducts to the horizontal. Maximal tightness is the leg is unable to adduct to the horizontal, which it did perfectly, so she passed. And then next would be the anterior impingement test. Okay, so there's the anterior impingement test. Okay, so take you. I'm gonna raise your knee, and I will internally rotate and abduct. Okay, and then you have the. Oh, I'm sorry, I did that incorrectly. So I'm supposed to raise your knee, internal rotation, and abduct. Okay? And a positive sign for that test would be pain or symptoms in the hip are reproduced. Did your hip hurt? No? Okay, she said no. And then next is the hip scoring test, which is the hip quadrant test. Step right here, the camera can see. Now we'll use this leg and raise it up, press down, and just externally rotate the hip and internally rotate the hip. And a positive sign for that test would be pain or symptoms in the hip are reproduced. Did you experience any pain? She said no, in case you can't see her moving her head. Okay, we also have the rectus femoris contracture test. So I'm gonna ask for you to slide to the edge, have your knees dangling off, okay? And raise your leg, raise your knee to your chest and pull, okay? And can you hold that for me really quick? Okay. And her hips stay on the table. If they were to raise, that would be an indication of a positive test. Okay, you can let it go.